Hello and welcome to volunteer training for FCA All Ability Initiatives. Today we're going to cover over some training goals. We'll familiarize FCA volunteers with all abilities athletes. We'll enhance volunteers' comfort level with working with athletes with disabilities. And we'll try to provide some useful strategies to getting the best out of the athletes with whom you are working. And our agenda for today, we will talk about why all abilities in general. Then we'll also get to know some of our all abilities athletes. And then from there, we'll finish up with some communication skills and tips for you to help you interact with your athletes. The training team today is Joan Bauer with Summit County Board of Developmental Disabilities, Megan Smolk with Akron Children's Hospital, and me, Tristan Griffin with Fellowship of Christian Athletes. And so with that said, I'm going to get into training. The first topic is just why all abilities. And so the FCA mission includes every coach and athlete, right? And this is a tremendous challenge because every includes every, which means that we have to adapt to different ages, cultures, abilities, and so on in our attempt to be intentional about making every coach and athlete feel comfortable engaging with FCA. In particular, all abilities is FCA's attempt to include people with disabilities in the sports and church environments. In our quest to help all abilities coaches and athletes feel comfortable with FCA, it's important that we educate ourselves on the culture and customs of the disability realm. Thus, this training will help us all understand the disability realm a bit better so we can better serve coaches and athletes with disabilities. With that in mind, I'm going to pass the ball to Joan to talk a bit more about disability in general and specific types of disabilities we might encounter in our endeavors.
So before we talk about all abilities athletes, let's talk about what is a developmental disability. So it is a natural part of the human experience, and it does not diminish the right of individuals with developmental disabilities so that they can enjoy and live independently and have self-determination, make their choices, contribute to society, and experience full integration and inclusion in the economic, political, social, cultural, and educational mainstream of American society. So what is inclusion? Well, a vision for inclusion seeks to bring people with and without disabilities together in equal partnership to build and promote a culture of openness. So these elements might include relationships, shared experiences, advocacy, and a sense of identity. What is not inclusion? Let's say an athlete is included in a group, but they're not participating. Why is it important? Well, we share a common interest, and every individual is afforded a range of opportunities to participate. And how does this apply at FCA events? Well, some of the benefits of inclusion for children with or without disabilities are friendship skills, peer models, problem-solving skills, positive self-image, and respect for others. And this can trickle down to families and teaching others to be more accepting of differences. We're going to break down into non-physical and physical disability categories. We'll start with autism spectrum, also known as ASD. So in this group of developmental disabilities, it's defined by significant impairments that might have to do with social interaction, communication, and the presence of different behaviors and interests. Thinking and learning abilities can vary greatly. Characteristics may also include someone who may be preoccupied or focused on specific things. They perseverate on them. Their sensory systems might be heightened, and they might have difficulty understanding what you're trying to tell them in a sequence that you're trying to tell them. And you'll notice on each of these slides, or most of them, that there is a link to a video. So make sure you look at it and you'll get some more in-depth information. So in non-physical for Down syndrome, again, there's a video link there on the bottom. This is a genetic disorder that is associated with the delay in cognitive ability, physical growth. Some of the characteristics include there may be vision, hearing, or speech impairments that may also impact communication. There may be low muscle tone exhibited. And one important thing to remember is they may tire quickly, especially when they're out in the elements. And there are a lot of individuals that are very social and they like to express themselves physically through hugs. So attention deficit hyperactivity disorder, also known as ADHD, it is a condition that is marked by persistent, developmentally inappropriate levels of inattention, impulsivity, and hyperactivity. Again, you might see some disorganization, distractibility, and they may be seeking stimulation. So for other non-physical, we'll talk about how a camper may be impacted in their ability to self-regulate or control their emotions. Many people view this as acting out or misbehaving. There may be sensory processing disorders, and campers may exhibit a wide range of emotions and behaviors. Frustration level that's visible to all individuals. They may be easily agitated. And the one thing to remember is to look for those triggers that may cause that agitation. And once they are agitated, they may be difficult to reason with. But there is a high level of play that they are capable of. So cerebral palsy, there are 2 videos on that one. So it is a disorder of muscle tone, movement, or posture that may be caused by brain damage before, during, or following childbirth. So some of the characteristics you may see. Again, it varies greatly. There may be impaired motor control, balance, coordination, speech may be difficult, quick to dehydrate and fatigue. But again, socially, they may be strong, and cognitively, they are strong. We talk about TBIs, or traumatic brain injuries. This could be a permanent or temporary impairment of cognitive, physical, and psychosocial function resulting from a bump, a blow, a jolt, or a penetrating head injury. This could happen from outdoor play, a motor vehicle accident. Someone could have slipped, tripped, or fell. And again, it can range from mild, which could be a concussion, to severe memory loss. Muscular dystrophy. This is also a group of muscle diseases that results in increased weakening and breakdown of skeletal muscles over time. So there are about 30 genetic disorders that go with this, and they're usually classified into 9 main categories or types. An individual may use braces. They may also have had corrective surgery to help with some of their symptoms, and they also attend and benefit from physical therapy. So when we speak to visual, we're speaking to someone who may be visually impaired or blind. Once again, their other senses might be heightened. Again, their cognitive abilities are always there. And someone who is visually impaired may require, or usually requires, more than one buddy, one on each side, especially when they're involved in group activities. For those that are deaf and hard of hearing, they also may be high functioning other senses and cognitive abilities, but please remember with both of these impairments that there may be some things that are used, glasses, hearing aids, cochlear implants, and make sure you're being observant and paying attention to what they're coming with so that you can be responsible for it as well. And most of all, we want them as presumed competence. We always want to know and believe that our athletes are able to accomplish what they want to accomplish in the activities that they're involved in until you see otherwise. Right? And how we're going to make this happen, we are going to make sure that as buddies, that we're going to make ourselves familiar with what the diagnosis of the camper is and whom they are working with, and that we know everything that we need to know and that we ask the questions that we need to ask. And remember, you can ask the individual, but if they are not able to help you with what they need, then please ask the person that brought them. I'm going to move it on to Megan.
All right. One way that we want to help our volunteers interact successfully with our athletes is by offering you some communication tips. These tips may not be needed for all of the athletes. However, these slides will include ideas that you may find useful and can help you get familiar with terminology that you may hear at the event. First, I want to introduce you to the concept of person-first language. Of course, the best way to find out how someone prefers to be addressed is by asking them. However, person-first language is typically regarded as being respectful to each individual because it recognizes a person's identity is made of more than his or her disability, and it can reduce the negative attitudes about the disability. Here are some examples of person-first language. Please say person with disability instead of disabled person. Consider saying individual Down syndrome instead of Down syndrome individual. You would say Sarah has a learning disability instead of she is learning disabled. You would say Maria uses a wheelchair instead of she is confined to a wheelchair. You might say Tom has a mental health condition instead of he's emotionally disturbed or mentally ill. Remember, when in doubt, you can ask the person you're working with how he or she would like to be addressed. In the autistic community, some individuals prefer to be referred to as an autistic or autistic person instead of person with autism because autism is a part of their identity. This is called identity-first language. Language and its meaning is always changing, so it's important to recognize that best practice is evolving too, and therefore it is always best to ask the individual for their preference. Another important concept that we will use at our event is called front-loading. Front-loading occurs when we give someone a heads up and mentally prepare someone for what is going to happen. This lets the athlete know what to expect and reduces the unknowns about an activity or an event. Front-loading can reduce anxiety and fears about what is to come. This can also help to reduce tantrums and meltdowns. Front-loading can be done verbally or with pictures or visual supports. Here are some examples of visual supports that we may use at our event to provide front-loading for our athletes. The macro schedule may be used as a large poster at the event's registration area to show the list of activities for our event. The micro schedule may be at each activity station for our volunteers to refer to, and if your athlete finds it helpful, to look at the pictures during each station to know what is happening at each station. The activity card may be used at each station and allow the volunteers to check off the completed station for his or her athlete so the athlete can see how he or she is progressing through the event's activities for the day. Volunteers do not have to use any or all of these tools if your athlete does not find them helpful to participate in our event. The communication board for basic needs has common pictures that athletes may want to use to indicate if they need something. These boards may be at each activity station as well. Visual timers may help the athletes visualize how much time is left for each station and know when the activity is going to be over. To further reduce anxiety, we may use several strategies to communicate when it is time to transition to the next station. As I already described, you may see picture schedules at the stations. We may also have a large clock for athletes and volunteers to see how much time is left at each station. Volunteers may find it helpful to use an app on their phone, like the time timer, as a visual timer to show his or her athlete how much time is remaining at the station. An announcement may be given at the 5 minutes remaining mark of each activity. And music may be played at the 1 minute remaining mark to communicate when to transition, so that the athlete can complete his or her current activity and switch to the next activity. Other strategies you may want to use include use of first then language. For example, first get the ball, then kick it in the goal. Also using concrete language and not figures of speech like killing two birds with one stone. Using one-step instructions instead of too many tasks shared all at once. And being patient and allowing time for processing your instructions. For example, if an athlete has a 5-second delay with responses, you may have to wait 5 full seconds for the athlete to hear what you said, process what it means, and then follow through with a response. Another tip is to be engaging and excited, be genuine and encouraging and not patronizing. These athletes will have fun if you're having fun. Be sure to listen and watch your athlete and ask questions to confirm. 90% of communication is nonverbal. So it's important to get to know your athlete, and then you have a better idea of when he or she is engaged and having fun, since this may look different for each athlete. Now let's talk about types of communication. We always think of communication as talking or having a conversation, but it is so much bigger than that. Athletes may use one or a variety of communication methods. Verbal speech includes saying words, word approximations, or vocalizations like crying, whining, and pleasurable coos. Nonverbal speech includes facial expressions and behaviors, pointing, reaching, pulling you over to an item, waving, clapping, and sign language. Some athletes will have an augmentative and alternative communication, AAC, device. Some individuals refer to this as their talker. If an athlete has his or her communication device with them at camp, then he or she is likely skilled enough to use it independently, and you won't have to know how to work it yourself. Some individuals may use a system called picture exchange communication. This is when he or she points to or gives a picture to you as a form of communication. Many kids use more than one of these methods. So what should you do if there's a communication breakdown? A communication breakdown may occur if an athlete is upset or they need something, but his or her communication is unclear. If this happens, try these steps. Ask for clarification or to repeat oneself if able. Then you can try using the communication board if available. These have basic wants and needs listed. Point to and say the word and look to the athlete for a response. If the athlete remains upset, look for a volunteer, a leader, a caregiver to assist or trial some of the behavioral supports discussed in upcoming slides. Here are some basic signs that your athlete may use or that you can use to communicate with your athlete. You have help, more, finished, water, bathroom, mother, father, please, and thank you. Some athletes might use a communication device to communicate if they are not able to speak verbally or have speech that is difficult to understand. Pictured are some examples of communication devices. Each device varies person to person. Some use less buttons while others have different levels they use to show pictures or keyboard formation. If your athlete uses a device, don't panic. This device is his or her voice. He or she will push the button and the device will speak the words. If your athlete has a talker, please make sure that he or she has access to it at all times. You can hold it while your athlete is doing activities, but don't set it down and walk away from it. That is his or her voice, and taking it away is like covering the mouth of a verbal person, and we would never do that because we value his or her words. Responses using this method of communication may take longer, so please be patient and encouraging. You can use prompts like "tell me on your talker." Out of respect, please do not use an athlete's talker unless instructed to by the caregiver or the athlete. And here are some final words on communication. Find out ahead of time how your athlete communicates by reading your athlete's profile, and don't hesitate to ask the athlete or parent if you have any questions. Provide help when needed, but don't assume that it is needed. Ask questions to the athlete first and then the caregiver if needed. Also, when meeting your athlete for the first time, introduce yourself to the athlete first and then ask who he or she brought with them to meet the caregiver. Here are some strategies that all athletes will benefit from. Face-to-face communication. Sit or stand at your athlete's eye level when you can talk with your athlete and make appropriate eye contact. This is especially helpful with athletes who are deaf or hard of hearing. Use normal tone of voice with all athletes. Be patient and allow extra time for response, and do not speak for the athlete. Try combining a word with a gesture or a movement to help with understanding. When you're communicating with an athlete with limited language use, it may be helpful for you to combine a word or phrase with a gesture. For example, point to the net while saying kick the ball in. Use communication boards when you're unsure or need help and need to ask for clarification. Communication boards are a visual way of representing speech. They let people with a disability express their needs and communicate using pictures. Acknowledge emotions and your athlete's communication attempts. You may say phrases like, "I can help you. I see that you're excited or scared or hot or upset. And let's talk or let's look." If you don't understand what the athlete is communicating, don't panic. Encourage the athlete to use all forms of communication we discussed above to help you understand. Be patient and reassure the athlete that you hear him or her and will help. Once again, we want our athletes to feel loved and encouraged to participate and have fun. Now I'll be switching topics to something you may see at our event. One of our athletes may have a meltdown. But did you know this is different than having a tantrum? Knowing the differences can help you ensure that your athlete will have an enjoyable experience at our event. In this diagram, the similarities between a tantrum and a meltdown include an individual who may be screaming and kicking and biting. But the difference in why these behaviors happen and how to help if these behaviors occur. A tantrum is driven by a want or a goal. It's usually because the individual wants something. He or she checks to make sure someone is paying attention to the behavior and acts this way in front of an audience. The individual stops the behavior once he or she gets what they want. For example, a toddler is at the store and asks mom for candy, but she says no. So the toddler may kick and scream to get mom's attention and would stop if mom gives the toddler what he wants or if she ignores the behavior. But with a meltdown, the individual is driven by a reaction to something. This is not a choice. This may be a reaction to overload or feeling overwhelmed. This individual does not care if they get attention, and the behavior continues without an audience. There is no goal, so the behavior will only cease once they've calmed down or a loved one helps them gain control. For example, a child may be overtired and become overstimulated at a fair by the large crowds and loud noises. Then this child may become so emotionally overwhelmed that he loses control and cannot keep it together anymore. This child does not even know what it is that he wants. So here are some tips to avoid a meltdown. Use front loading to give the athlete a heads up to what's coming. Have a schedule with a picture, visual, or verbal, whichever works best for the athlete. If appropriate, pair visuals with verbal requests. Try to use first then language. Try to reduce sensory input like loud sudden noises, stressful situations, peer interactions, etc. Make sure that you have reasonable expectations of the athlete and the activity, and provide choices when able. To handle a meltdown if it occurs, stay calm and limit your communication methods to decrease overstimulation. You could ignore the behavior, but never ignore the athlete. If the situation seems dangerous, help remove others and provide a quiet, safe area. It's okay to ask a volunteer or caregiver for help. Be patient and allow the meltdown to run its course. Reward positive behavior. You don't need to discuss what happened right away. You can always debrief later with the athlete. And see if you can determine what might have triggered the situation and adjust it in the future if possible. Thanks for joining us. Please reach out to your local FCA staff if you have any questions.